So wealth and health. So we're looking at the link between wealth and health, and we can explore this link by looking at the difference between wealth and health in HICs and LICs. So despite making up most of the global population, LICs, countries in Africa and Asia, make up far less of the global wealth, which you can see by these small green bars, than our richer North American and European countries, which you can see by the green bars. So if we look at life expectancy, generally North America and Western Europe have the highest life expectancies, countries in Africa, countries in Asia with the lowest life expectancies. Very, very similar pattern when it comes to wealth, gross national income. The richest countries are in North America and Western Europe, and again, the poorest countries are in Africa and Asia. What that leads to is a clear difference. So when we plot income and life expectancy on a graph with proportional or dots proportional to the size of the population, we can see that the blue countries, the African countries, have been left behind. They are very poor and therefore less healthy, whereas the richer countries in Europe and North America have a higher income and therefore are healthier. We can look at some of the reasons or the indicators. So in LICs, the health indicators, very, very high incidence of infant mortality, children dying before the age of 1 because of poor healthcare, more tropical diseases such as malaria, but also infectious diseases such as cholera and dysentery, and more women are likely to die in childbirth. Whereas in a HIC, in a rich country, more children are likely to make it into adulthood because of a better quality of life, access to food, and better nutrition. Whereas respiratory diseases are the only diseases really that cause high level of death in HICs. Mainly the illnesses that kill people are chronic illnesses in HICs, so things like cancer, heart disease and dementia. Those are usually associated with an ageing population, which means that most deaths in HICs happen in the elderly.